The information that follows in this video may or may not apply to babies younger than 3 months of age. If your child falls into this age group and you suspect fever or illness, please call Children's Medical Group. You can either schedule a sick check or ask to speak with a member of the nursing staff. What is a fever? A fever is a high body temperature. It's one way a child's body fights being sick. A fever shows that the body is responding to infection or other illnesses, both minor and severe. A fever is a symptom. It is not an illness by itself. In children, it's important to look at other symptoms, how they act, and to listen when they talk about how they're feeling. A fever can be a sign that a child is ill, but most fevers are not caused by a serious problem. Don't rely on temperature alone. Care at home may be all that is needed. More on this in a moment. Types of fever. With the exception of children 3 months and younger, the following definitions of fevers should help you put your child's level of fever into perspective. A temperature of 100 to 102 is considered a low-grade fever. It activates the body's immune system. It's a protective mechanism. Try to keep all fevers within this range. 102 through 104 degrees Fahrenheit is considered a moderate grade fever. It's beneficial to the healing process. Over 104 degrees Fahrenheit is a high fever. It is uncomfortable for children, but it is harmless and treatable. Over 105 degrees Fahrenheit is also a high fever. However, it suggests a higher risk of bacterial infection. Finally, over 106 degrees Fahrenheit is a serious fever. The fever itself can be harmful. It should not be treated at home and requires immediate medical attention. Fever treatment. Although a fever cannot be cured, it can be treated. You can make your child comfortable by using acetaminophen, also known as Tylenol, or ibuprofen, also known as Motrin or Advil. Using these medications is effective, but only when administered correctly. First, do not alternate between Tylenol and Motrin. Please use one or the other. Secondly, do not administer them using common kitchen utensils like a teaspoon. Instead, you'll want to use the cup or syringe provided by the manufacturer to ensure proper dosing. Next, manage fever by giving Tylenol or Motrin every 4 hours as needed. Finally, proper dosing is based on the weight of your child as shown in this chart. This dosing table is available in your Caring for Your Baby book. You can also request a copy of this chart from a member of CMG's nursing staff. When to schedule a sick appointment. If your child has a fever without any other symptoms that last more than 24 hours, please schedule a sick appointment. You will also want to schedule a sick appointment if your child has a fever associated with earache, persistent cough, runny nose, congestion, vomiting for more than 8 hours, excessive crying without a cause, listlessness, stools with blood or mucus, difficulty breathing, rash, headache, or stiff neck. Children's Medical Group is always happy to see your child when they aren't feeling well. When in doubt as to whether or not a sick appointment is necessary, please call our office and ask to speak with a member of the nursing staff. When reporting fevers, tell us what the patient's temperature is and exactly how you took it. Do not add or subtract any degrees. Our nurses will help you determine if home treatment can be attempted or if they need to be brought in for an evaluation.